Hi everybody, Deb here again, tuning in for day 2 of our EULAR debriefs. And I just watched a session on EULAR recommendations regarding lifestyle behaviors. And the overall title of the session was Promoting Lifestyle Factors in RMDs. And I figured what I think you guys are going to want to see most is truly knowing what the recommendations are that are out there right now. So I'm going to focus on that, and I'm going to break it down into different sections. The first section is the recommendations for physical exercise. They talked about exercise is beneficial for many health outcomes, including and not limited to the RMD systems and the progression of the disease. So patients with RMDs should exercise because of the benefits on pain and function, and as well as the quality of life. Patients should avoid physical inactivity and should have regular exercise according to your ability. Patients should have both aerobic and strengthening exercise. Aerobic is really getting your heart rate up, and strengthening is just that, strengthening your different muscles and different groups of your body. And with at least moderate intensity, you want to get your heart rate up. Patients should be told exercise is safe and it's never too late to start. Exercise can be performed in different settings, alone or in groups, but they said there was a slight benefit to favoring the group exercise versus doing it alone. Diet. Healthy, balanced diet is key to lifestyle improvement. Patients should also be informed that consuming specific foods is unlikely to have large benefits on the outcomes. Alcohol, there's a host of these. Alcohol consumption with the patient, it should be discussed together with the healthcare provider, as well as when you're starting new treatments, mostly related to methotrexate. Patients should be assured that low levels of alcohol is unlikely to negatively impact your disease outcome. Patient with RA should be talking to their healthcare professionals that moderate, especially if you're having moderate alcohol consumption, it can be associated with increase in flares and increased comorbidities. People with gout should be aware that, again, moderate alcohol intake can increase gout flares. Smoking. Patients be encouraged to stop smoking and be informed that smoking is detrimental to symptoms, function, disease activity, disease progression, and the occurrence of comorbidities. So it's definitely tied to that. Patient with RA should be aware that smoking may affect DMARD treatment response. DMARDs are things like methotrexate, so keep that in mind. Weight. Patients should aim for healthy weight. Okay. Patients who are overweight or obese should be working with their healthcare professionals to achieve controlled weight loss, as well as a healthy diet and increase physical activities to have overall beneficial outcomes. Work can be beneficial to all the effects on the outcomes in a patient with RMDs. Therefore, they should receive attention within their healthcare consultations. They need to address it and make sure people know that being docile and not having activity can be detrimental. So there were actually a few overarching principles that they said with these lifestyle factors. Lifestyle improvements complement medical treatment and they don't replace that. Lifestyle improvements are part of the disease management and adds to health benefits. The World Health Organization recommends that the healthy lifestyles are definitely applicable to patients with RMDs. Lifestyle recommendations for each patient depend on factors like age, sex, health condition, if you're pregnant, and also all the comorbidities that are happening in our lives. And regular discussions with patients and their healthcare professionals regarding lifestyle factors will have a overall positive effect on the patient. So having regular discussions, it's really important. So those are the things I really pulled out and I felt that were really important to give everybody information on, because these are things that are important to all of us, and also knowing what the recommendations that are out there. I will do a separate piece and post some photos, and we'll get those to you too. Have a great day.